We're going to get the details of all of this tomorrow, and it's important to be clear what it is we're going to get. We're going to get an expansion of the welfare state. The means test for free social care is going to be lifted. There's going to be a cap on the lifetime money that you can pay in a lifetime into social care, not into accommodation, but into social care. And we're going to find out how the government intends to pay for this. That national insurance hike that you've been talking about. Now, it sounds as though they've settled upon a figure of 1.25%. And our poll suggests, just like the polling they've been looking at in there, no accident they've landed on this number, that there is, at the moment, the polls suggest quite a lot of public support for just that sort of level and moving on national insurance, not on income tax. It seems to have a sort of special aura, national insurance. People see it as definitely being spent on nice things, they feel, like pensions and the NHS. The truth is it goes into a great big pot. And the great danger, if you're someone who's concerned about the social care system, is that a lot of that pot could be eaten up by the demands of the NHS. And that is something that a lot of people are conscious about, and one of the battles that's been going on until the last minute in here. The other problem is that although our poll says Tory supporters, perhaps even more than the public in general, support this move, Tory MPs are in a very different place. It was quite hard to find a Tory MP today who wholeheartedly backed this idea. Some of them don't like the idea of increasing the state and raising taxation anyway. Some of them think you should pull a different taxation lever, but a lot of them are very opposed to the idea of going for national insurance. You might be wondering why, as you said, 2 years into a premiership, why is Boris Johnson doing this now? Someone who saw him recently said they were telling back to him the quote that he'd said here on the doorstep about how he would sort social care. And they said they had a strong sense from the Prime Minister's grimace in front of them that quote weighed very heavily upon him. But there are, as you'll see in this report, a few other quotes that he was making around about the same time.
Pay less tax, and I think that is what the people of this country want.
Boris Johnson said his election manifesto promises, including social care reform, would not need national insurance hikes.
Here's the kicker. Here's the really... We can do all these things without raising national insurance contributions.
Amongst Tory MPs returning to the Commons for the start of the new session, a cool response to the Prime Minister's emerging plan to boost government spending on social care and pay for it with a national insurance hike.
Do you think it's a good idea to break manifesto pledges for social care?
No.
I mean, I feel insurance is better than tax raises. That's really all I want to say right now.
There, you sit down. There we are.
The problem the Prime Minister says he wants to address, a care system which leaves many, like Maurice Stinson and Peter McNeill in Keighley, worrying they could burn through their savings and have to sell their home to pay for care if his health worsens.
You just don't know what is going to happen. And if it should be the case that Peter had to go into residential care, that's extremely expensive and it will eat up the money that we now have left, having spent so much money already on the house.
Not just cuts in national insurance, but a tax lock. A tax lock.
Breaking tax promises, Boris Johnson is hoping, is something voters will forgive if the government is taking on such a huge issue. He's been encouraged by private polling. And our opinion poll suggests that is what voters are saying right now. Amongst those who expressed an opinion on whether there should be a 1% increase in national insurance to pay for social care, 55% approved, 25% were against. But if you ask whether they support a 2% rise, support plummets. 37% were for it, 40% against. So the sweet spot, according to this polling, is 1%, and national insurance is preferred, rather than income tax as the lever to pull.
The public prefers it because they have an idea that it is some kind of insurance to pay for their pension or to pay for the NHS. But I'm afraid that is just total nonsense. It's just another form of tax, but it only falls on earnings rather than other kind of income, for example, from shares or from renting out properties. And as a result, it's a very unfair tax.
Amongst Tory supporters, our poll suggests there could be an even higher rate, 60% support for a 1% rise in national insurance, just over 20% against. Many Conservative MPs are in a different place.
It's just not right, in my view, for young people to be asked to pay more national insurance so that older people can pass on more assets to their children.
The £10 billion raised by what's expected to be a 1.25% national insurance increase is supposed to be shared between the NHS and social care, with social care's share going up over time. You struggle to believe that will actually happen. The NHS will just carry on gobbling up the lion's share.
Well, all experience tells me that pressures on the NHS never actually withdraw. There's never going to be a point where the leaders of the NHS are going to say, fair enough, that extra £3 billion we've been having for the last few years, give that over to social care. It's very, very unlikely to happen.
Peter started work when he was 15. He worked in agriculture, steel construction, and spent 20 years as a bus driver. He's paid his taxes, he's paid his national insurance, and all he was entitled to was 8 weeks of care.
Peter McNeill, like many others, is hoping for a more generous means test for social care costs, and he wants to know what the cap for an individual's care costs will be set at. Tonight, the only number announced was an extra £5.4 billion for the NHS to cover COVID costs and the impact on waiting lists for the next 6 months. A reminder of the competing demands for every penny the government raises or borrows.
Well, as we've just heard from Gary, the Prime Minister has announced tonight a £5.4 billion injection into the NHS in England in the next 6 months. Well, joining me now to unpick this number is our Health and Social Care Editor, Victoria MacDonald. Victoria, unpick it.
Well, at the moment, it is just an initial announcement, but it is hard to exaggerate, Matt, the real concern there is in the health service about the state of the NHS. There are exhausted staff. There are staff leaving in huge numbers. There is the huge waiting list backlog. There are people in pain now not getting the elective surgery that they need. Sajid Javid has already said in the press statement that we got today that the waiting list, for instance, is going to get worse before it gets better, which is an amazing admission to come from the Health Secretary themselves. A message, of course, to those behind us. This is more than £5 billion. Let me tell you what they're going to spend it on. £2.8 billion for COVID-19 costs, and that is important, including infection control measures. £800 million for day-to-day costs, £478 million for an enhanced hospital discharge, and £1.5 million for elective recovery, including £500 million capital funding. Now, just going back to the enhanced hospital discharge, over the past few weeks there have been growing concerns about the number of elderly patients in particular who are being stuck in hospital beds because there isn't the money in social care. So it comes back to the whole swings and roundabouts of this. What the reaction has been is, well, one charity said that it's a good start. The Health Foundation has said it's a first instalment, and the Health Foundation today said themselves that we need £17 billion more extra for England for the remainder of the Parliament. So a start. A start.
Victoria, thank you very much indeed. Well, the pressures to spend more on the NHS in the short term and social care in the long term are, as you just heard from Victoria, extremely clear. But the way that national insurance works has raised doubts about whether it is fair between rich and poor and between the generations. So what is the right answer to these very big spending challenges? Here's our economics correspondent, Heli Ebrahimi.
Fairness, that's the big criticism. In the last 20 years, we've actually seen similar hikes in national insurance, with politicians sometimes seeing it as a more palatable tool than raising income tax, which hasn't gone up since 1975. But the central problem around using a jobs tax to fund social care is that it takes money out of the pockets of working-age people for the benefit of the elderly who don't pay any national insurance at all. Let's take a look at some examples. Here's our first 21-year-old. He's earning £20,000. If national insurance goes up by 1.25%, he'll end up paying an extra £130 a year. Now, his twin sister is also 21. She earns £50,000 a year. She'll end up paying an extra £500 a year. Their grandfather, who is 66 and also enjoying £50,000 of income a year, pays absolutely nothing. And that, say critics, is fundamentally unfair, especially given how much wealth is in the hands of the older generation. It's worth remembering that 50% of social care funding is actually allocated to people below pensionable age, something that's all too often overlooked. In any case, the big calls on spending from social care to the NHS will take much more than the £13 billion that this tax hike will generate. And if you want to raise a lot of tax, you need to tax a lot of people. And one of the restrictions of national insurance is that it's too narrow. Outside its empire lies all sorts of wealth: pensions, state and private, income from dividends, from property. Plus, the self-employed don't have employers paying their half of the tax. And compared to income tax, it's regressive because the threshold for paying it is so much lower. So how can the government impose a tax rise that is generationally and also on the income spectrum so unequal? The Resolution Foundation said today it would also have to increase tax on the self-employed, on wealth, make working pensioners contribute, and raise the national insurance threshold so that lower income workers aren't targeted. That's quite an ambitious agenda. And remember, this decision is all part of the autumn spending review. That will be the first multi-year departmental budget since 2015. And critically, it'll be the first time the government sets out in full its post-pandemic, post-Brexit strategy for the size and role of the state.